Dear audience, good day again, and welcome to the second part of the Cercanits International Health Tourism Conference. With the topic and overview of health tourism globally and a positive way forward. In this block, we will have 4 speakers, and the first one will be an editor-in-chief of International Medical Travel Journal and a consultant for Laing Buisson, Mr. Keith Pollard. Second, and he will present the presentation with the topic, the impact of COVID-19 on the global medical travel market.
Morning, everyone, and thank you to Alfred and the Kavana Health Cluster for inviting me to contribute to your event today in Quick Venice, even if from a distance. My name's Keith Pollard. I'm the editor-in-chief for the International Medical Travel Journal. And as you see today, here I am at home in my small town of Berkhamsted outside London, and unfortunately unable to join you in Quick Venice. What do I do in my day job? For those who don't know me, I'm the editor-in-chief of International Medical Travel Journal. I work for Laing Buisson, a large healthcare company in the UK, and I oversee the content for IMTJ. I work on a lot of our annual reports, particularly our medical travel and tourism global market report. And you may well have seen me at a number of our events in the UK and internationally. I chair the IMTJ Medical Travel Summit, and of course the IMTJ Awards, which went virtual this year. Today, what I want to share with you is a kind of overview of the impact of the coronavirus on the medical travel market. And I'm going to be looking at where we are now, healthcare provision, how that's been impacted, the impact on patient flow, patient perception, and patient communication, and finally the way forward, and prompt some thinking about how Croatia might combat the threat of coronavirus. So where are we now? Well, the reality is this is a global pandemic. This is the latest data on deaths per million of population. And as we see, some countries have been extremely hard hit, and some less so. But the reality is this has affected every country in the globe and had a serious impact on both travel, tourism, and specifically medical travel flows. But this was a graph released by the World Travel and Tourism Council back in March, when they were predicting what the impact of COVID was going to be on global travel. And as you see here, they were actually quite optimistic. So bear in mind, this is in March. They were talking about the opening of borders and the lifting of travel restrictions, potentially happening in July, September, or December. We're now in October. And as we know, we have a long battle ahead for anything to get back to anywhere near normal. In the UK, as I'm sure you've read in the press, we haven't done the best job of dealing with this virus for a number of reasons. This is data from today. So this is the 28th of October, a couple of weeks ahead of your event. The latest daily figures, we had 367 new deaths yesterday in the UK, and the issue, of course, is that these numbers are rising. So this takes us back to the peak in April, May, where we were seeing 750, 800 deaths today. The current 7-day average is now at 200, and it is rising steadily as the infection rate rises across the UK. And in the UK, we have regional lockdowns. About half the country, the whole of Wales and parts of Scotland, are effectively in lockdown with the closure of shops and of course bars and restaurants. Fortunately, I live in a part of the country outside London where we haven't been as restricted as many other parts at the moment, but I believe that will change in the not too distant future. So how has the travel and tourism market and healthcare responded to the threat of COVID-19? Well, what we have seen is a number of initiatives. particularly in travel and tourism, in terms of certification, and they've both been global, regional, national. And I wanted to share a few examples with you. The first is the Safe Travels stamp, which has been introduced by the World Travel and Tourism Council. And this is an attempt to certify destinations, tourism operators, travel operators to ensure that they are following COVID safe protocols. We've also seen regional activity, and here's an example from the Caribbean, which covers all of the Caribbean islands. Obviously, tourism is a massive contributor to their economy, and they've introduced a healthier, safer tourism program. And indeed, this has gone down to the country level, and this is an initiative within Turkey, where they've introduced healthy tourism certification for anyone involved in the travel and tourism business in general. We've also seen moves by airports. So there is now an airport health accreditation certification that airports can comply with. And this is an interesting one. This is an initiative from the World Economic Forum. They're trying to develop something called Common Pass, which is to simplify the issue of who do you let in and who do you stop coming into your country, and how do you get proof that they've had a COVID test and so on. And they're trying to introduce an international standard, app-based, that would enable a traveller to prove their health status related to COVID-19. And of course, there have been moves from some of the healthcare accreditation bodies to certify hospitals and clinics as COVID safe. One of the leaders in this is certainly TIMOS, who have a COVID-19 safe certification. And we also have GHA coming from the USA. So their attempts to say to a patient that a hospital or a clinic is COVID safe, it's applying COVID safe protocols. But we've also seen this in particular destinations. And Dubai Health Authority, that runs the health tourism program for Dubai, has introduced certification for what it describes as non-COVID hospitals. So defining that hospital as a non-COVID hospital that will not accept any patients that have or have tested positive for COVID, to enable them to treat patients. Is insurance the solution to overcoming the COVID-19 problem? And a couple of initiatives here that are worth commenting on. Singapore has introduced an insurance product for visitors to Singapore. It's called the Singapore Pass, and what it does is it covers people for the costs of treatment for COVID should they catch it whilst in Singapore, and this is a travel insurance product. Emirates Airlines, which is obviously important to the Gulf and Dubai in particular, has introduced a travel insurance program which they're providing free to anyone who flies Emirates. And this is free COVID-19 cover to cover the costs of any complications that a visitor may experience. So how's it affecting healthcare provision? Well, certainly if we look at the UK and around Europe, hospitals are having to spend more money and spend more time to actually do their work, their regular surgery and their regular operations. The cost of PPE, of protective measures to protect against COVID, and obviously this takes more time. And that means less theatre time. I've heard it estimated from hospital operators that they have 20% less theatre capacity because of the protocols that are in place to ensure that an operation is COVID safe. And of course, there are fewer beds available, that hospitals are being occupied by COVID patients, and therefore there's less capacity to treat regular conditions and provide treatment. This has been particularly true in the UK, and what I'm showing here is National Health Service waiting times in the UK. We have a free to use health service, and this is the data comparing July 2019 and July 2020. And the top bar is the number of patients who have to wait more than 18 weeks before they have their operations, and this has increased fivefold and is increasing by the day. And the number of patients having to wait more than a year to start treatment, to have their operation, has gone from 1,000 to 83,000. And this is because our private hospitals and our national health service hospitals have been dedicated over a period of time for managing COVID patients. So how's it affecting patient flows in medical travel? Well, I've shared with you a survey, and this was done back in kind of March, April, of people around the world involved in the medical travel sector and asking their view of the future in terms of COVID-19. So we asked them, what has been the impact on your international patient numbers? And these three bars on the left demonstrate the massive effect. You know, many destinations have effectively closed down. You know, international patient numbers in April dropped by anywhere between 50 and 100%. So, you know, medical travel, like travel and tourism, effectively came to a halt. We also asked them, how long do you think this is going to last? Now, bear in mind, again, this was back in March, and people were saying, well, you know, 6 to 12 months time, we'll be back to normal. But of course, that was before this happened. So we saw, this is global data, this was the peak of deaths resulting from COVID back in April, and it fell and it fell and it fell, and we now have this resurgence which is affecting every country. There are a few countries that are not seeing this resurgence, and the second wave, you know, is it going to be as bad as the first wave? The massive impact on international patient departments has to be acknowledged. You know, certainly we've talked to international patient departments in the UK and across Europe, and they've taken a number of measures, and these are difficult decisions to take. You know, many have decreased working hours, they've laid off staff, they've furloughed staff. You know, less than half at this time, and this is back in April, said they hadn't made any changes to their workforce at that point. But you know, the big questions with the resurgence, the second wave, international patient departments and hospital operators are going to have to ask themselves the question, who stays, who goes, how long can I keep them employed when we haven't got a job to do in terms of international patient work? And can I redeploy them? I know that in one of the major London hospitals, all of their international patient staff have been redeployed into other areas of the business. So how's it changing patient perception? And again, these are the views of the people in the medical travel world we surveyed. Simple message here was that they felt, and I agree strongly with this, that patients are going to increase the time they take to book travel and the actual travel date. So whether they're traveling for dental work, cosmetic surgery, cancer, IVF, I think these things are certainly true. These patient concerns about COVID are going to extend their decision-making time. And what does that mean for you? Well, if you're running a hospital and clinic and you're trying to attract patients from abroad, converting interest into action is going to be much, much harder. It was already hard. It's going to get much harder. We asked our panelists, what do you think? How do you think COVID-19 will affect the distance that patients will travel? And the simple answer is they believe, and I agree with this as well, that patients are not going to travel as far. So when you're looking at your catchment area for Croatia and where your patients are going to come from in the future, I think we have to acknowledge that patients are not going to travel as far. They're certainly going to be less inclined to fly. They'd probably rather cross a border on a train or in their own vehicle. And I think cultural match is going to be much more important. It was already a key factor in patient choice, but the question is, to what extent will they trust your destination? And that means that you've got to rethink your target markets and where you aim to attract international patients in the future, be that in 6 months or 12 months time. We also asked them, how's it going to affect, how do they think patients' choice is going to change in terms of where they buy from? And the view was clearly that they're going to select destinations that have managed COVID-19 better, and they're going to be much more focused on the safety of the healthcare provider. So if COVID-19 is an influence on patient choice, the question is, well, who will they trust in the future? Will they be more focused on or inclined towards established brands? Will they go for destinations that are seem to have beaten COVID? Destinations such as Korea, which has benefited enormously, I think, in terms of its global reputation, in terms of the way it's handled the disease. And destinations that are perceived as COVID safe, that have implemented protocols both for travel, tourism, and their hospitals. Now, who can I trust? Now, and here is a concern, and I want to highlight this. This is the latest data on the number of COVID deaths per million of population. And, there are countries that have got low rates, and there are countries that are high rates. And as you'll see from this graph here, Croatia is up the top of these figures that I put on this chart, alongside the UK and the US. So in terms of the death rate, Croatia's up there with some of the countries that are struggling. Down the bottom, of course, Germany and South Korea. I think both will have handled this well so far. Although again, in Germany we see a significant resurgence with the second wave. So I think the reality is nowhere is safe, but you have to convince a patient they can trust your destination. How's it changing patient communication? Well, if there's one thing that has changed massively due to COVID-19, it is that telehealth is here to stay. And what we've seen is a massive uptake by consumers. Here's some US data. The number of US consumers using telehealth up from 11% to 46%. People saying virtual healthcare interactions are going to top 1 billion by the year's end. And some patients, patients in one survey saying, well, it actually increased their involvement in treatment decisions. In the UK, my local GP, you cannot get to see my local general practice at the moment. It is by phone, it is by Zoom call, it is by telehealth. So what was for many hospitals and clinics a nice to have in the past is now absolutely a must have, and it is an integral part of your international patient program. So let's look briefly at minimizing the impact and potentially what you can do to exploit whatever opportunities there are in medical travel. So for Croatia, in medical travel, is COVID-19 a threat or is it an opportunity? And the reality is it is both. And clearly from that data I showed early on, Croatia has some major challenges in terms of this disease. So what can Croatia do better than anywhere else to create competitive advantage? And I'd like to leave that kind of as a topic for the panel discussion, which I believe is taking place later after these presentations. And what you really have to focus on is how you're going to react to the future faced by this pandemic. And it is about being proactive. And I think what you've seen from some of the slides in this presentation, how both regions, countries and destinations some of them are being much more proactive than others in putting in place what's needed to say this is a safe destination which you can visit for travel, tourism, and indeed for medical travel. If you're running a hospital or clinic and your international patient program is a big part of your business, you're going to have to take a serious look at restructuring that business, because the reality is, in my view, medical travel will recover. It will not recover in 2021. It will come back slowly during that period, but realistically, we're looking at 2022 with luck and a following wind. So you really need to think about how you're going to manage those staff and what you're going to do for the future. And finally, rethink your strategy in terms of the markets and the opportunities. We've seen that one impact of this COVID-19 pandemic is that there is massive pent-up demand for treatment. So it's a case of looking at which markets, potentially in a much closer area than you've been thinking of before, present the opportunities to exploit that pent-up demand for treatment. So capitalize on the pent-up demand, exploit the opportunity. I think this is a real topic for the panel discussion later in the day. So thank you for your time. I believe I'm going to be able to join the panel discussion online later in the day. If you want to keep up to date with what's going on with COVID-19 and medical travel, please visit imtj.com. We publish regular updates on everything that's going on in the industry related to the pandemic. Thank you very much.
Thank to Mr. Pollard. We will continue with the next presentation by the topic that's urging us to take the chance. So use the chance. Health will be the new currency and the new status symbol. So to all of you that may question yourself about the future of investment, inflation, deflation, our next speaker, Ms. Cila Mezeshi, Secretary General of European Spa Association, she has the answers.
Good afternoon, and thank you very much for Kvarner Health Cluster for the invitation and for Crikvenica for the organization. And I guess all of us, we are not happy not to be in this nice resort, but we are positive, and I really like the title of our agenda, Positive Way Forward for Health Tourism. And today, I hope end of the year, we will get a lot of information and ideas from each other that we will survive this crisis, and in long term, we can make also fantastic business of that. So as you see, use the chance. Health will be the new currency. It's already a new currency and definitely a new status symbol for Europeans and worldwide. We have to work not only with the politicians, but also with our target group and to get our new target group, because most of the people will be much sensitive for the topic health, and they will invest in health. Not everybody will trust on the public health system. So definitely what I want to explain you, how to change our communication, how to provide new services in health tourism. As a representative and General Secretary of the European Spa Association, I will tell you this content or new advice from the perspective of European health resort, medical spas. And as you see, we don't fight against coronavirus. We fight, as the most important American medical journal says, Lancet, we need a much better prevention, and actually we fight to have a much better control and health services, to provide better health services for control of chronic disease. Balneology and health resorts could be one of the main products as we heal without side effects, and climate health resorts at that time are not that high on the agenda in the tourism business or health tourism, but this will be definitely one of the future projects that we have to go on. And I was very surprised that studies which was made for Davos World Congress was not that much published when they asked people if the COVID-14 and Corona-19 vaccine are available, how many people will take it, or how much they want to be in the first line to get these vaccines. This is definitely a huge help for tourism that our industry will still keep alive. But surprisingly, countries like Russia, Poland, Hungary, France, 20% of the population, and if you talk about Belgium, Germany, Netherlands, Great Britain, it's less than 50%. So this is one information why we have a good chance, and for me the message that Europeans need, or we have to offer other alternatives for pandemics or for this kind of crisis situation in the health sector. A new market analysis from Germany, and I know that for Croatia and for many countries, Germany is the main source market. So when they ask people, how do you understand health? And our main target group, which is the 50 plus, I see some big changes in the answer. I'm not surprised that most of the people are telling personal well-being, and it's getting more, I would say, more educated tourists with almost 60% balance of body, mind, and soul. But the big change, and I see from 10, 20 years, it was more like a passive services, do the best with me, and I hope I will get healthy again. Now, the understanding is much more about personal fitness. We want to be fit and motivated. So infrastructure in physical activities, in the nature, and a lot of other entertainment which has to be related to sport. Which is our main agenda and the main project now on. With COVID-19, we will receive a lot of new target group, but we have to change also our services, we have to change our communication. So I would say new orientation means we have to show our medical competence. And most of our members, and I brought some good examples. For example, in Iceland, they are very specialized and I would say a very, very healthy and traditional nutrition program with mental health. From France, I brought the idea about mental health program, spa, rehabilitation, and mental health clinic in one resort, corporate health management. And before COVID came, and the European Union's health agenda, the most important topic was EU beating cancer care. And in this way, the French colleagues are doing a really good job. So I hope this network will have to exchange this kind of good experience within each other. So healthy lifestyle, we have to communicate, and our medical competencies in this relation has to be strong together. Prevention of chronic disease, and which is still not published that much. But I see from some of our members, they do a really good job, and even privately, I ask many times, rehabilitation of COVID-19 patients. And of course, because of the aging population, how to age with vitality. That these kind of programs will be very important. Besides our services, I mean, what we offer in medical spas and health resorts, we have to take care, and that should be the main difference between other touristic destinations, the healthy environment. So we have to provide a green, sustainable destination and not overcrowded destination, because that's what most of our clients will look for. Some example, again, from Germany, from North Germany, from an island, healing forest, which was made for kids, always on the mobile devices, and losing motoric and balance competencies. So even for the young generation, ICC, World Health Organization, the European section, because we have this healthcare system and the tradition with the medical spas and health resorts. So they made already information leaflets about self-management and rehabilitation for COVID-19 related illnesses. That's why I'm asking you again, as we have a ESPA e-library where we try to collect all medical studies, and mostly we would like to publish much more updated information from all our member countries, because this is the only library where doctors and politicians and anybody, even end users, they can look for information. As I said, prevention, rehabilitation, and to fight against COVID, it's not only about vaccines, and that's what we have to prove. And for example, our chair members made, I would say, the best case how to use the money of state aid which was provided by the European Union. They had a kind of voucher system only for medical spas, minimum booking of 6 nights and 5 medical treatments. And one other example from our Lithuanian colleagues, where they give voucher for the medical workers, and now they prepare a separate program for teachers. Again, market analysis, one is taking us calm down, and our tourism will grow in a smaller steps, and we have to wait until we come back to the level what we would like to have, or what was before the COVID-19. But as you see, our main target group, 50 plus, 70 plus. This study was also made market analysis just end of October. Our main target group is still willing to travel. And from this target group, almost 60%, they say they want to travel abroad next year. They have really good plans and they want to keep it. They have money, they have time, and they want to spend it in Europe. Corporate health, which is definitely the success for the business. And in Germany, and this should be for most of us a good example, to work together and to develop programs with the insurance companies, with the health insurance companies. And here the prevention program made especially for craftsmen businesses, more than 50% of the whole cost for this prevention will be paid by the health insurance company. But also another example from Slovakia, they made, for example, for obesity, which is actually today will be published by the European Union for the Commissioner for Health. Beside cancer care, the second big project which will start, it's also fighting against obesity. But why we are happy, and now we have, I'm asking you for teamwork. Before the holiday, summer holiday, the European Parliament voted the resolution to support tourism. And one specific agenda was dedicated for health tourism, medical wellness, spa, prevention, biology, sustainable tourism. Here, it's our goal to provide the right contact for the Commission to make also the right tenders and state aid programs for health tourism. How the future and the market is moving. And this is also important information, data from Slovakia. They made a research about percentage of people they have medical spa holidays, which is paid by the health insurance and the private payers. And as you see, the most growing part is the private payers. So that's why they need other kind of content from us. We have to explain them, we have to educate them, and we have to serve with a lot of information of the medical result, because they are paying by their own. We are also in contact with the European Health Expert Group, and we try to promote climate health resort medical spas and all our huge portfolio and medical services and good medical staff. So EU citizens are demanding sustainability for environment and nutrition, but now it's really time also for sustainable methods in the medical treatment. I don't know how many of you follow the Congress of the European Union mid of October. As you see, we do believe that health tourism has a much better future, and in this way we provide services for citizens, for the region, for the domestic and for international tourists as well. Immune system boosting and healthy lifestyle. This is what people will easily understand. Also politicians hopefully will understand, and that's why we have to provide these special new products and to explain much more about the services behind it. And this is again a brand new study about German tourist plan for 2021. Croatia, you are in the top 5, so it's not only beach holiday. Try to promote also your health resort and climate health resort on the seaside and the mountains, as you are very loved by the main source market. As you see, when they look for which kind of product and environment they are looking for, it's definitely #1, sustainable health offer, and to be away from overcrowded destination. The question how they book, it's more complicated because definitely online booking is #1, but the pandemics and the regulation with the guarantee by the travel agencies showed much more comfortable system by the travel agencies. If you book online, you have to go for each services. Maybe you spend some months or a year to get back your money, but if you book by a travel agent, you get it back in a few weeks and the whole amount. So how to improve the health destination? The good message for us, back to the roots. We are not having the water parks and only entertainment. We have to show our medical competencies. So with healthy eating, with healthy recreation, a very green and sustainable environment, and using local remedies. Also, for me, it's very important whenever we talk about natural remedies, without side effect. And as you see, more opportunities for smaller, less crowded health resorts. And definitely the safety, hygienic, has to be in a completely other level. And it's a quite balancing act for us, how to be part of the, or to show serious services like in a hospital, but in another way, we are still leisure, recreation, having fun, holiday, entertainment. So, but maybe in the panel discussion, we can talk a little bit more about it. All our publications were concentrating on the 5 future big growing potential subjects: respiratory problem, cardiovascular disease, overweight, mental health, and lifestyle changes. These are our 5 main groups where we have to concentrate. And I was wondering, when the European Union still showing information in an official way that there is no cure for COVID. Yes, there is a cure, and we had to react that we are very sorry that they are not informed about this know-how heritage of Europe using natural remedies. And even in the first wave and the second wave, most of our members were a really strong partner for the public health care. And now we are actually only the one main partner to provide COVID rehabilitation as well. It's not exactly related to our Congress, but it's a big challenge now, and we have a very hard discussion in the European Spa Association, the medical devices regulation. Please check these regulation of the European Union, because we have 2 groups, and now soon we have to find our decision in which part we will see the future. Do we have to make a new certification for all our natural remedies, or the older one, which was given by the national health authorities, is still available, and we don't need any changes. Please note the date of our next Congress. We have Croatia, Terme Tuhej, in a very good memory. And the next Congress will be in Slovenia, which is not far away from you. So hosted by a Program Innovation Award and the International Press Trip, which was a really, really good success. We try to combine Congress and business. And if you have any question, please check also our website, europeanspa.eu, or follow us on Facebook, LinkedIn. We try to publish a lot of research programs and information, and I'm happy to work with Partner Health Tourism as well. Thank you very much.
Thank you very much, Cila. I would like to remind you all that after the last lecture and presentation we will have today, there will be opportunity for all of you that have been registered as attendees in our event app to send us your questions, and we will relay them through the studio to all of the speakers. So if you have any questions, any doubts, or would like to learn something more about the presentations we have provided for today, you're welcome to ask us following the last presentation for the slot that we have prepared for the questions and answers. And the next speaker that will present a topic of strategic harmony, response to a global wake-up call, is actually in our studio. It's Professor Velimir Srića, a lecturer, researcher, politician, and consultant. Professor Srića, good day and welcome.
Thank you very much. I'm very pleased to be able to share some of my ideas with you, even though now it's going to be something completely different. I am not really an expert on health tourism. I'll try to connect my topic with the topic of this conference. It is based on my new book, Empower Us from Crisis to Strategic Harmony, and the book is just right now in print, so you are among the few people to learn about the ideas from this book. Why do I call this presentation a wake-up call? Basically, it's not just because we are surrounded by COVID and pandemic and problems of that kind, but also for the last decade or so, we are surrounded by very interesting times. The military researchers call it the VUCA times. Basically, we are surrounded by volatility, uncertainty, complexity, ambiguity, and we are experiencing the world in a very different way than we used to. Continuity is replaced by disruption, not just because we are getting sick by the virus, but because of technological changes, social changes, political changes. And this is what I'm going to talk about in my 15-minute slot that I have been given. In Zulu language, Vaka means to wake up. And in my view, that's a great situation for the mankind, for the human race, to be able to wake up. Whatever we do, are we in health tourism or in any other profession, we have to wake up and use the opportunity to change. I had a possibility to talk about this 1 week ago at the World Marketing Summit. So there I was talking to 500,000 people. I mentioned that because today you have a possibility to organize conferences for such huge audiences because they're online. Usually these conferences have been given to a group of 4,000 people or so. This year it was 500,000. Disruption is perceived by most people as a crisis. COVID-19 changes everything. GDP is falling down, employment rate is falling down, our habits are changing, we have to work from home, hospitality and travel industry are severely hit, we have to experience social distances. But disruption lasts for the last 50 years. Let me just remind you on some basic changes. 50 years ago, 15% of kids would be born out of the wedlock. This year, it's 70% in Iceland, 50% in neighboring Slovenia, 30% in Croatia. So family as an institution is losing ground. We don't trust governments anymore. As you see, the trust in governments dropped significantly. The same is with business leaders. We don't trust business leaders. the number dropped from 65 to 18% in 50 years. We don't trust media. We keep talking about fake media and fake news, and we are surrounded by a huge noise in the information area that make people misunderstand the world more than understand the world. At the same time, digital has started to rule the world. Zoom, I give my lectures on Zoom practically every day, and that company is worth the same amount of money as 7 top world airlines, and they have huge airplanes and a lot of physical equipment behind, and Zoom is just a piece of software. At the same time, we are surrounded by disrupted values. We have threats to health and survival. In my view, there are 2 pandemics right now, not just COVID, but pandemics of depression. Because in the developed world, when I was studying in the United States, there were 4% of people, elderly people, struck by depression. When I was teaching there at UCLA some 2 decades ago, it was 11%. Now it's 14%. So we have a global pandemic of depression. We have growing inequality. The richest 0.1% of people control 90% of private wealth. We are surrounded by political gridlock, corruption, distrust. You can win election if you have enough money. We no longer experience caring, compassion. No lives matter, not just black lives. Everything is on sale. Today you can buy position, you can buy power, job, love, justice, health, youth, sport results, even a verdict. Mass consumption culture has created a brainwashing environment in which the real values are really something that is left behind. Our social life gets distracted and destroyed, and we are surrounded by raising voices of people fighting for the rights of the women, like Me Too, against weapons like Never Again, Black Lives Matter, and marginalized groups. Technological disruption is taking place at the same time. We have big data surrounding us, artificial intelligence, social networks. In health and tourism, you can experience robot receptionists as a consultant. I have introduced that in some companies. Virtual reality tourism, the film Social Dilemma describes very vividly what happens with the social networks and the alienation and problems that we are surrounded with. Next generation is really changing the world rapidly. You see 6 guys here, young people, they don't communicate, they spend most of their time on their mobile devices. According to Pew Research, 57% teenagers met a friend online, but only 1 out of 5 decided to meet this person in person. So new generations are alienated, and they spend 4 to 5 hours per day on digital platforms. Disruption issues are very deep, and not just pandemics. It affects health, tourism, and every other activity, and this is my point. Values and ethical compass are violated and broken. Exponential pace of change in technology is taking place, and we can solve any problem if we have enough money and time. But traditional management methods are overwhelmed. Modern managers cannot handle the volume of information and change, and they are unable, in principle, to basically run the change situations efficiently. Reaction cycle has shortened. Decisions must be done very fast. Like my friend Jack Welch would say, managers are either quick or dead. And we're surrounded by many institutions run by dead managers, not dead literally, but dead in managerial terms. And wherever we look around us, bureaucracy is standing in the way of innovation. So basically what I'm talking about is that the world is in a great situation to change the mindset. The COVID pandemic will put us in that position. Changing the mindset is important. Why? Let me share with you a brief story. Imagine there are 5 monkeys in a cage, and up there are bananas and a step ladder aside. And very quickly the monkeys will understand that if they push the step ladder in the middle, they will be able to climb and reach for the bananas. Once they do, and they start doing it, you start sprinkling icy cold water on their backs. Why? To send them a message: don't go near the step ladder and don't climb for bananas. Now they will learn the lesson and they will change. They will stop doing it. You can close the icy cold water sprinkle, you don't need it anymore. Now you bring another monkey into the cage. this guy or girl will try to use the opportunity and start climbing the stepladder, but all other monkeys will prevent this animal. After a while, you'll probably have a bloody monkey and 4 wet monkeys in the cage, and nobody will touch the stepladder. Imagine you bring another monkey. Now you have a dry monkey, 1 bloody monkey, and 3 wet monkeys. The new monkey will try to use the opportunity, and everybody will try to, as Americans would say, pardon my language, beat their asses. And it will end up like this. If you replace all the 5 monkeys with 5 newcomers who have never experienced icy cold water, what will the newcomers do? They will never touch the stepladder. They will never dare to climb up. Why? Because they have learned the lesson how you behave in an organizational environment. This is a sad story about the culture. I use it as a consultant to describe organizational culture. I use it to describe family culture to my kids. I use it to describe national culture, global culture. A pandemic is a very rare situation where we can question our culture, we can question our values, and we can try to replace them with better values. At the same time, we must be aware that change is very difficult. My favorite book, one of my favorite books, is Change or Die by Alan Deutschman. He describes an interesting thing in his book. Imagine you come in front of a doctor, and he says, you're dead unless you're willing to change. You have to change what? You have to quit smoking, stop drinking, stop eating fat and sweets. You have to start exercising, and then you will be healthy. The research shows the research study shows that only 1 out of 6 people will really change. What will happen with others? 2 will try to change, but after a while they will give up. They will go back to the cigarettes, to alcohol, to the drugs, whatever. 3 out of 6 will even never try. They will just search for excuses. So this is the story about our capability to change. Our propensity to change, our ability to change is very low. Everybody will usually say, I'm all for change, but don't change me, change somebody else. This is a very important idea because when we are talking about global change and the future of the health, tourism, and every other activity, there is a need to change the mindset. Why? Because mindset is based on values, what we believe in. And our values dictate our behavior. We behave accordingly. And then the outcomes are the result of our behavior and our values. So if we dislike the outcomes, if we are displeased with health tourism or political situation or economic situation or family situation or whatever, we have to deal with values first. The key problem in our book, because I have a co-author, Ira Kaufman, who is an American, is the fact that we live in a disharmonious world. Our world is filled with a lack of harmony. Basically, our crisis is an opportunity. And this is how I perceive crisis in general. In Chinese, you express the word crisis with 2 ideograms. The first one is opportunity, and the second one is challenge or danger. So crisis is at the same time a danger and opportunity. And if we look at COVID crisis as an opportunity, we can change everything starting tomorrow or starting today. So basically in our book, we are talking about strategic harmony as the post-COVID mindset. It's important for any type of human activity. Strategic harmony is an idea for all stakeholders. Are you in health, tourism, as a manager or worker, or you want to deal with your individual problems or your team, your family, your organization, your community, nation, the continent, even the globe and its ecological problems and health problems, you have to look at it from the harmonious point of view. What is strategic harmony? Basically, it's a search for internal harmony. First, we have to find a balance inside ourselves. Then it's organizational harmony, harmony with our environment, harmonious democratic systems, political environments, economy, harmonious tourism, health tourism. In search for harmony is basically based on 5 H's. What we think with our head, what we do with our hands, what we feel with our heart. Is it aligned with our hope, the purpose that we are doing something? And is it all harmonious? In our book, we are talking about test values. Test values are the key for the success in anything you do, including the health and tourism. First of all, we need trust. We need trust as the key ingredient in everything we do. As we have seen, trust is very destroyed as a value in society. The second value is empathy. The third is sustainability. We have to fight for the world in which we live sustainable life. And the last one is transparency. Transparency is a possibility to use modern technologies in such a way to share all the information and make it transparent. If I had more time, I could go into details. I just want to make you think a little bit about the new values and the potential that the crisis holds in itself. How can you turn it into something practical? Our book is based on a model that is oriented towards managers and people. So first you test your mindset. You search for the new values to be part of your everyday life, no matter what you do. Then you test your organizational culture. You try to teach yourself as a monkey and other monkeys in the cage that they are able to change, and then we can change our values and introduce new and better values. Then you can test your business model and see how trustful it is, how much empathy is there, how transparent it is, and does it take care of sustainability. Then you can test your execution strategy, your day-to-day operation, as well as your sustainable impact. If we had more time, now I would go through 10 steps of or 10 rules of the post-COVID mindset. I will just mention 2, but that's a list. First of all, we need to change managers. Managers should become catalysts, or we call them catalyzers. Catalyzers are people who are able to bring change quickly. They are not bureaucrats who fight for change in a very slow and tedious and boring way. They are change agents. Trust and transparency are number 1 on my list. Here is my friend Jack Welch, who was proclaimed the manager of the 21st century with his wife Susie, and my wife Anna is on the picture as well. Lack of candor is the dirtiest little secret in business, is what Jack Welch said. It's true for health tourism, it's true for politics, it's true for anything you do. But at the same time, we are not surrounded by trust. We live in a distrustful environment. And we have to change this value. If we want the world to survive, if we want all the activities to prosper and to develop, we have a unique opportunity to turn our crisis into a possibility to introduce more trust. The second on the list is empathy. Empathy is traditionally considered to be a weakness of modern managers. If you say this manager is filled with empathy, then you look at this guy or this girl as somebody who is not really a good manager. He's too weak and unable to perform his job. But in principle, empathy today is the key source of success. And empathy tomorrow must become the key value in our environment if we want to restore harmony. Recently, Harvard Business School is basing their education and teaching on empathy. They have developed Global Empathy Index as a means to measure empathy and compare companies depending on how much empathy they are able to express. Empathy is our ability to step into other people's shoes and look at the world from other people's perspectives. That's why empathy is very important. I have tried to use my 15 minutes just to make you think about the world that can be different and the values that are important not just for health tourism but for all other activities. And in the meantime, we have to work very hard. If we don't work hard, nothing will happen. I always talk to my colleagues or my students or as a consultant, even to members of my family, I share with them this particular slide. You will be successful because you're lucky, but you will never be successful unless you are ready to work long hours. Basically, this is what I wanted to share with you, and I hope that I have at least helped you shake a little bit your head and consider the possibilities of the future that can the COVID crisis bring and the chances that we have to make the world a much better place and a much more pleasant and much more harmonious in our life and in our profession.
Thank you, Professor Striča. At this point, usually the real lifetime events, there'd be a loud round of applause after it. But nevertheless, we have to get what we get. And that means that you will be able to get the opportunity to ask some questions following our last presentation of this block. So I'm quite honored to introduce again because he is our speaker for several years now, with the topic of unlocking the health tourism lockdown. He's the president of Stackpole and Associates Incorporation, and it is Irving Stackpole. So let's listen to the next presentation, Unlocking the Health Tourism Lockdown.
This is Irving Stackpole, and I'm very pleased to be with you at the CIHT conference, the Krivenica International Health Tourism Conference. I want to thank Alfred and Vladimir for inviting me here again. And today, in this presentation, I want to talk with you about health tourism unlocking the lockdown. There's quite a lot going on. We are all experiencing this together for the first time, including developing conferences remotely and individually. So I hope that this goes without hitch and that there's value to be derived from it for you. As you may know, I've been the principal of Stackpole and Associates since 1991. We've worked all over the world with my colleague Elizabeth Ziemba. We published the first book on medical tourism marketing, and with another colleague this year, Laszlo Puszko, we hope to publish another version, another updated marketing handbook for health tourism very shortly, and the information about that is on the screen. So for this particular presentation, what I'd like to cover are the factors impacting health tourism, medical tourism, specifically related to the pandemic. And there are external factors, there are demand factors, and in that is included travel and the psychology and behavioral science associated with the pandemic. There's the supply and capacity issues associated with the pandemic, and where I believe and how I believe the path to recovery will begin to appear. The first thing, of course, is to understand that health tourism is not a monolith. It's not an industry. It's not a sector. It's a set of highly fragmented, regionalized markets for specific types of services. And these services array along a range of acuity or complexity. And there's a direct relationship between the complexity and the frequency. And it looks something like this, where on the high volume, low unit value side of this market are dental and low impact cosmetic procedures. Also on this side would be spa treatments, balneotherapy treatments, and other wellness and health related treatments, what my colleague Laszlo likes to refer to as hedonistic treatments. On the other side of this vertical red line are low volume, high unit value procedures, orthopedic procedures, cardiac procedures, vascular procedures, and many forms of cancer treatments. Also bariatric procedures. So these are low volume, high unit value types of procedures for which health tourists travel. And this relationship between high volume, low unit value and low volume, high unit value comes to bear on how we believe the markets for health tourism will recover, which I'll cover at the end of the presentation. The market factors, which are now and have been since the beginning of these markets, the beginning of the emergence of these markets in the very early 2000s, is the destination stability, the perception of destination stability among the consumers. Access, how easy is it to get to the destination? The economics, are the economics of the destination location good for the source location consumers? It's certainly far less expensive for me when I'm in the United States to travel to Mexico for care On the other hand, for Mexicans traveling to the United States, there's quite a hill to climb because care in the United States is so much more expensive. So that's what we mean by inflation, recession, and purchase power parity between the countries. The next factor is capacity. Is there capacity for the targeted service in the destination location? And certainly in the category of health tourism in these markets, providers around the world have been building capacity. Kavarna Health is all about building capacity in the Kavarna region for the providers that participate in that cluster, in that marketing group. Bagatang Clinic is another example, and there are many others as well. And the final factor is, of course, the reputation and the brand of both the destination and the providers. And these interact with each other in a way that I'm sure you can appreciate. We'll discuss a little further. So this is an historical comparison of travel. This is taken from Flight Radar 24, which records all of the air trips around the world. And this is a 7-day moving average of commercial flights between 2019, which is the green bar at the top, and January 1 to March 2020 in the blue bar at the bottom. And as you can see, the number of commercial flights fell off precipitously. There's a dramatic change, and we've all noticed this. This is nothing new. What we have seen is we have seen a bit of a recovery in the commercial flights, as you can see in this upswoop in the tracking line for the 7-day moving average of the number of flights. This recovery is very slow and very gradual. And as you will see from other data, these travel recovery, which is of course central to the recovery of health tourism, is also manifest in other economic recovery data that we look at. And here we see the recovery data in GDP for several European countries. And the recovery, you'll notice the pattern here isn't a U shape or a V shape, but rather is more like a Nike swoosh. And that's how the recovery from the effects of the pandemic will be manifested, how it will be seen throughout the world, in part because of the lack of coordination of the effects of the pandemic and the response, the public health response by countries, by nations, even by regions to the public health crisis, the pandemic. In addition, the capacity is an important feature of the attractiveness of a destination location for health tourists. Why would a health tourist go to a particular destination if the clinics, the hospitals, and the providers weren't able to serve that consumer and weren't able to demonstrate capacity and demonstrate ability? Well, in the case of COVID, there's been a real impact on capacity in many locations around the world. And now, unfortunately, after having gone through the first wave of the pandemic, we're now going through a second wave, which has a double whammy effect, a double effect on not only travel, but the confidence that consumers have. One of the reasons for this asymmetry in the response to the of consumers to the crisis has to do with confidence. And some percentage of the business that had been health tourism for hospitals will simply not come back. And being able to gauge what that is and in which markets will be central to our ability to plan for and effectively leverage the recovery. So one of the factors that is occurring around the world, it was written about in The Economist in May, is pent-up demand. Certainly providers in certain locations as they begin to open up, are experiencing a surge in demand. It's very difficult to get surgical suites booked for elective procedures, for example. And that's because of the phenomenon of pent-up demand. Just because travel locked down and because hospitals weren't accepting elective procedures during the worst of the pandemic, it doesn't mean that individuals didn't continue to need or want certain types of procedures. So there will be pent-up demand that can be taken advantage of immediately following recovery. So what are the keys? What are the keys to unlocking this lockdown? Well, the first is to look at new markets. And these would be individuals who are looking for services, looking for other service lines that perhaps your destination hasn't been known for, or perhaps you as a provider have not historically provided. So there's not only new markets, but new source marketplaces. And one of those new source marketplaces might be right next door. Instead of going across the region or across international boundaries, it will probably be very important in the recovery effort to go closer to home, to look closer to home for consumers who need or want the services you provide. Another set of tactical observations have to do with consumers' fear. And I think this is tremendously important. There was always a certain level of uncertainty and risk associated with traveling for healthcare, and that fear or concern, that uncertainty and that risk is redoubled. It's doubly increased in this time. So one of the things that we'll need to do as providers and as destinations is to demonstrate and show safety, which historically was not a very good thing to do from a marketing point of view. There's lots of research to show that safety isn't the kind of quality or feature that providers should be promoting. But indeed, in this environment, that's exactly what's necessary. And what the pandemic has shown us is that the health tourism journey will be changed, that consumers in the classic model typically go from what's known, go through trust and uncertainty to go to the unknown. And in health tourism, that was certainly true. That psychological or emotional journey has been impacted by the pandemic, and we as providers and as destination managers need to be aware of this and attend to it. Well, how do we do that? Well, certainly, if you clean it, will they come? A takeoff on the movie, if you build it, will they come? And we need to show or demonstrate that our facilities, our centers, our hospitals, our clinics are clean, that we've attended to the basics and even gone beyond cleaning and introducing standards and symbols. All of these logos are proxies, are symbols that show that we as providers, we as hospitals, clinics, and destinations are attending to the important feature of sanitization and cleanliness in our centers. This will help reassure consumers and to bridge that uncertainty. In addition, a critical element is testing. And I have a video, I hope it plays here, to show even SpongeBob SquarePants gets the importance of testing. So testing is a central part of what's needed to move beyond the uncertainty and to transform the needed customer uncertainty to customer certainty. And there's SpongeBob again. So what does health tourism, medical tourism, the recovery look like? As I said at the beginning, health tourism isn't one market or a monolithic block. It's a set of vertical regional markets. And the way these markets work, we can predict what the sequence will be in recovery. And in fact, early evidence suggests and bears this out. The first segment that will come back will be the vanity, or what my colleague refers to as the hedonistic market. These are low-end cosmetic and dental procedures, even somewhat more complex cosmetic surgery. So look for hair transplantation, dental veneers, orthodonture. Look for these cosmetic procedures to come back first. These consumers will also be far more risk tolerant. So these segments, these verticals will come back first. The second group that will come back at about the same time are the high acuity, the high risk consumers, because for many, it's the treatments that they're seeking are seen as life-saving, life-sustaining, life-extending. So there's really little option, perhaps, that they will have. So these two ends of this market distribution will return first. The middle will come back last. So here's the way we see this emerging. First, the market will unlock locally before it unlocks at distance. So look at source markets that are local. The first segments that will unlock in the markets will be the vanity and hedonistic segments. The second, very high acuity, life extending, critical procedures. The third will be the middle market. And unfortunately, historically, that's been the most profitable segment of this market, but that will actually recover last. The tentative attitude of consumers, their hesitation, needs to be central in our concern for how we manage this recovery. The remote solutions such as telehealth added to additional customer care, customer service, and management of leads will be very important for all providers. And the issue of fear versus risk tolerance will come center stage, and we'll need to do a far better job of segmenting our markets and understanding psychographically who's willing to travel and who isn't. So with that, I will say thank you very much. I hope this has been time well spent. I'll look forward to participating with you virtually and look forward to your questions as well. Here's my contact details. And once again, I want to thank the Kavarna Healthcare and particularly Alfred and Vladimir for inviting me here for this presentation. Hvala, thank you.
Thank you very much, Mr. Stackpole. And now it is the moment for all of you following us on all the digital channels. This conference is live to ask questions to all the speakers. You had the opportunity to listen in this set of presentations we provided. So please send your questions, but before we continue, we have a special person here with us that is not working from home, and this is Professor Sricha. And therefore, he's a very active and mobile associate of ours, and he will have to leave the premises of the studio where this conference is taking place. So please, I invite you all, if there are any questions to Professor Sricha, be free and welcome to send them immediately, and then we will continue with all the other speakers. If we don't have any questions from the studio, I have a question myself, because I admire personally to Professor Sricha's work and share ideas on importance of optimism. And my question is, how hard is it going to be after all those media titles, all those information that we're gathering now, all the restrictions, all the warnings, all the limitations that we're facing in our normal lives? How hard will it be, and how much will it take for us to get into a positive post-COVID mindset again?
That's a very complicated issue. If I had a good answer, I would probably win a Nobel Prize for it. But let me share with you one joke. 50 years ago, two shoe salesmen came to Africa. And the first one, after briefly searching the market, he said to his headquarters, "I'm going home, everybody's barefoot, there is no chance to sell any shoes." And the other one was optimistic. So he said, "Everybody's barefoot, we can sell millions of shoes, let's organize." And this is my message to everybody who is kind of pessimistic and negative, and this is how we should look at the headlines in newspapers, the news on television. We have to surround ourselves with positive feedback. We have to surround ourselves with positive people, with optimistic views of the world, because as Henry Ford used to say, if you think you can solve a problem, or if you think you cannot, you are right. So we must believe that we can solve problems, and if we fill ourselves with pessimism, it's certainly not going to work for us.
Thank you very much, Professor Sricha. Do we have any questions from the audience at this point? Okay, so Professor Sricha, thank you very much for your time, patience, and for all the optimism and energy you empowered us with. So we may continue with the rest of the conference today, and of course, there is a long day ahead of us tomorrow. So we will thank you at this point, wish you a pleasant and joyful and very successful rest of the day. Until we meet again, stay well and healthy. Have a nice one. And in the meantime, as I already said, I'm really, really interested to learn from all over the world, from all the speakers we had, and it's from Europe and from further away, what is staying or laying or running ahead of us. So I would like to ask first the first presenter, Mr. Keith Pollard. What advantages do you think that Croatia has that you would say are the most competitive in the global market and our utmost important opportunities?
As I said in my presentation, I think there has to be a radical rethink in terms of tearing up any strategy that was produced pre-COVID. Obviously, Croatia is seen just generally in travel and tourism as a premium destination. You're going to need to look at preserving that and targeting those markets that are very close to you. I suppose I'm a combination of a bit of a pessimist, but also a realist. And this thing is here, whether we get a vaccine this year or early next year, the next 12 to 18 months, nothing is going to change that much. I think there are concerns that there could even be a third wave of this vaccine. It's not going to go away. So it's about, in terms of competitive advantage, I'd recommend you look at what some other destinations are doing in terms of putting in protocols to present themselves as very safe destinations. And I think you've been a bit slow in that, to be honest. Take a look at what some other countries are doing. But to put in terms those protocols for travel, tourism, your hospitals and clinics, to convince those that can not fly but cross borders from Germany, Austria, that can travel by car to you, to convince them that Croatia is the right place to go. Obviously, with the issues around long-term COVID, I think there is a real opportunity for Croatia in terms of the health tourism business of benefiting those patients.
Thank you. Ms. Metsashi, can you please tell us, well, you're also living in one of Croatia's most important emitting markets. So what do you think would be advantages, and what would press people from your country or from the region to come to Croatia?
First of all, I would say Croatia has a much better chance than you provide at the moment in your whole communication and information system. Of course, I'm talking about the tourism market, not about the medical tourism market. You have much, I would say, lot of different products. As I said, climate health resort, like the seaside mountains. You have to show much more about the rehabilitation know-how and services. So at the moment, Croatia is known for beach holiday and coming for the summer season and visiting cultural places. But health tourism is not that much on the agenda in the whole promotional work as it should be. So definitely you have double, 3 times more chances if you put it on a higher level on the communication strategy.
Thank you, Cila. And Mr. Stackpole has already visited Croatia, has been the speaker in our conference and shared with us plenty of opportunities Croatian health tourism had last year, for instance. Has anything changed? Do we have any more opportunities to be more optimistic and to strive better in the 2020 or 2021?
That's a very good question. And I believe that there is. The assets that you have, the assets which made Croatia an effective promoter of health tourism haven't gone away. The physical assets are still there. What is more important, in my opinion, and I believe the data would support this, what's more important is the initiative and entrepreneurial spirits that exist in Croatia. The culture has produced some world-famous innovators, and I believe that within these small markets of health tourism, you have some stunning examples of this kind of innovation. The energy and enterprise growth, when it's allowed to reemerge, the energy and enterprise growth will come from the private sector, will come from private enterprise. And I think that this fact of these markets will endure in the post-COVID recovery time. There are markets now for providers in the market segments that I described in the presentation and to which Keith alluded in his presentation. There are markets now for cosmetic, low-impact cosmetic, the hedonistic kinds of markets. And even Scilla referenced the healthy tourism, green tourism. People are going to need a break. The professor spoke about Professor Strika spoke about the pressure that we're all under. This is going to start to crack, and from the cracks will emerge high-risk tolerant families and individuals who will want to go somewhere for a break. And why not Croatia? Near to home, Croatia Health has an asset and a global reputation as a healthy destination, and these can and should be leveraged.
Thank you, Mr. Stackpole. So basically, should we take a long dive, take a deep breath, and wait for the recovery in 2022? Or is there a space for us to invest immediately in marketing and do something about it and communicate, perhaps as Cila perhaps noted, immediately and communicate in a better way what there is in Croatia to provide? So to Mr. Stackpole, it would be the question.
So thank you, and I know Keith is going to want to jump in on this, and
yes,
Scilla, I don't want to send any aid, but here's what's going on. If global rhetoric is completely absorbed with COVID, with the pandemic, it's dissonant, it's incompatible to be sending messages about the beauty of your destination. It just doesn't work. What we can and should be doing are the sorts of research and studies that should have been done in the early 2000s to establish what the fundamental patterns are of people, of consumers, of individuals who are willing and able to travel for healthcare. The kind of research that we were able to do in very small amounts with, for example, South Korea, who was an early investor in better understanding the dynamics of these markets and has leveraged them significantly. So we're beginning to see global providers global agencies, global entities who are willing to take this as a hiatus to better understand what motivates people, what inhibits people, and so that when the travel markets, the basic underlying lubricant on which the health tourism markets ride, which is the travel markets, when the travel markets break free, we'll better understand, we'll be able to position providers and other suppliers in these markets to accelerate more effectively and more profitably.
Thank you, Mr. Stackpole. I will continue with the questions for Mr. Pollard and Ms. Mezeshi, but it appears that we have a question from the audience, and I will always appreciate and honor what the audience would like to know and get information about. So let us hear and learn what is the question for you. Does the panel see the healthcare costs and insurance premiums going up in post-COVID era? And can you please share your opinion? So let's start with Mr. Pollard at this point.
Yeah, it's a really good question, because the reality, certainly in hospital treatment, is their costs are rising significantly. And we see this, we're certainly seeing this in UK hospitals, and that will increase the cost of health insurance. So we're anticipating, what's interesting in the UK is that at the moment, more people are buying health insurance and more people are self-paying for treatment. And the reasons for that are that they're not getting access as they used to their National Health Service, to their public sector. But having said that, the cost of every operation is going up quite significantly, and that's down to the cost of PPE and the time that patients are spending in theatre, this impact on reduced capacity. So there's some good news for health insurers there. The numbers are going up, but the premiums, I believe, there's only one way they're going to go. The hospital is going to pass the cost on somewhere, and it's going to be the consumer ultimately.
Thank you. And related to that question, perhaps whenever we've been speaking about the health issues, especially nationally or nationwide, there was the idea of prevention and the value of prevention in diminishing the costs of the healthcare and healthcare insurances. So, Ms. Mezeshi, is there a perspective in prevention in the context of usage of spa and well-being treatments? Is that a future way of living? And what do you think, how in a post-COVID time ahead will people be oriented to healthier lifestyle and prevention programs, especially ones provided by the spa facilities?
That's one of our main services, to prevent and to provide healthy lifestyles. So it was always, when we talked to the health insurance companies, it was, I mean, in Germany they call it Vorsorgekur. So to prevent illnesses and to try to heal it with natural remedies, which are proven by evidence-based medical study. And now we have to talk also about digitalization, which will be very important, especially follow-up and to provide medical results, because this will be very important and should be actually the main change in our communication. It's not only that we have nice surroundings, very good services, you can relax very well, but if you visit this health resort, we provide you this very specific and try to concentrate on the risk group of COVID, because not everybody is COVID. So, and then to inform them, if you have this 1, 2, 3 weeks treatment with us, you have this additional medical result, and you can live healthier. As I try to show you also, Healing Forest or corporate health post-care, cancer care, they are all paid by health insurance companies in the European Union countries. And because we talked also about education or the need of staff, of well-educated staff, we try to also make participate in a tender and to explain that medical spas and our relation to tourism could be also helpful for flexible skill alliance programs, because when tourism has this problem that system doesn't work or it's shut down, then we can provide our medical staff to the healthcare, for the public healthcare. And when tourism is working very well, these well-educated health staff can work in medical spas. So this combination between the industries has to be maybe also one of the topics that we have to discuss with politicians and to provide these special, a little bit more flexible educational programs.
Thank you, Cila. And for the very end, there are many people that are watching us at this point that are maybe not directly involved in the industry. But one of the perspectives that is interested to all of us is investment as well. Each of us has invested in education, in facilities, in hardware, software, and all connected to the health tourism industry and businesses. So we would all like to know, what are your perspective on what do you think, how long will it take for the full health tourism recovery globally and in Croatia in specific? So let's start with Mr. Stackpole for the first one to answer.
Thank you for throwing me under the bus first. That's such a difficult question. And the caveats have to be so complete. It feels like I'm wrapping my answer up in bubble wrap and then cotton wool before offering them up. But if, as Professor Djigic suggested, that and this appears to be the trajectory for the vaccine and treatment agents, molecule-based treatment agents. It looks like we'll have vaccine distributed in 2022. And if that vaccine distribution imparts long-term immunity, something that people aren't talking about, the Pfizer vaccine trial received tremendous popular press because it was shown to be 90% effective, but there's a lot of longitudinal analysis that hasn't yet been done. We haven't had the time to do it. So if into the best circumstance, we could look into 2023 and a return to robust travel and a resumption of the markets, there will be changes. And those changes have to do with the investments to which you referred, which are principally in the technology domain. There will be a new deployment of technology, and a significant portion of the face-to-face care that has typically been a component of what we would call healthcare, that will be replaced with virtual contact. But as Cila will also reinforce, we are social beings, genetically, we are social beings, and we will crave, we will need that interpersonal, that touch. We will want to feel that human contact again. And certainly by 2023, those of us who haven't gone stark raving mad will be desperately hungry for that kind of personal contact.
Thank you, Mr. Stackpole. So, Cila, what do you think? How long will it take for everybody, for instance, from Hungary to come to Croatia for a treatment or for travel or tourism, for health tourism services or tourism services in general? Do you think that in 2022 you will back in the numbers from our clients from Hungary that we had in 2019?
Look, I have to be honest, I don't know that much the figures from Hungary at the moment, but I know from our 20 member states that they had a fantastic summer season. As you have seen, Slovenia, Serbia, Lithuania, Czech Republic, Italy, they made this kind of voucher system, and we would like to have on a European level also this kind of voucher system for as a pilot project, not to put all money for vaccines, just to provide as a pilot project, also with direct contact of follow-up with medical results for prevention and rehabilitation program of the European medical spas or health resorts. I do believe I hope we will not have a third wave, but if we can travel at least by cars within Europe, it will be more flexible. Then we can have even next year a very, very good season. But definitely in the meantime, in this light or completely lockdown, we should use the opportunity to develop, and we have to be honest ourselves. We are very old stylish if we talk about digitalization. In this way, we have to invest a lot. We have to provide a lot of more information and to be better connected. And 2022, I hope we will have a double of businesses than we had before if we communicate well. And for example, for Croatia, if you don't mind, I would give one idea, because in the coffee break, you were showing the advertisement videos, and Croatia is very well known from the fantastic sport teams and sport heroes. The Bavarian Spa Association managed to have Philipp Lahm as the main testimonial for the medical spas, and he's talking in the videos, in all messages. He's the main character of the whole promotion. He's talking about healthy lifestyle, about physical activity, about nutrition, how to exercise in the nature, just to be healthy. And this is our new target group, which have money. They travel, I don't know, overseas markets, having fun. Now these people, because as I said, the new currency and the status symbol is health, they definitely will spend much more money and to invest in health. So we have to provide the right product and to communicate it well. So in this way, I advise you to use the sport leaders of your country to promote healthy lifestyle, and then in this way, Croatia will be much more well known. Or if they have any kind of operation rehabilitation program. 2 years ago, I was invited in Zagreb to a conference, and there was a professor who is he did a very good way the presentation, how many very famous sport man he is treating. So try to provide this information to the world, because now it's kept in a very small business circle, and it should be much important to share this with the end clients.
Köszönöm kívánok, Ms. Messzesi. And the last for today will provide the answer, Mr. Pollard. So what do you think, this recovery process, when will it happen, and will Croatia be a bit ahead of the process and the global trends?
I'd echo what Erving said. My thinking is very aligned with his. I think if you're looking at medical travel in terms of global medical travel, the volumes, the number of patients traveling in 2021 might be 25% of what it was historically. 2022, 50%. 2023, as Erving said, let's hope we are back to some kind of normality. You know, a lot of people have pinned their hopes on a vaccine. We have 11 vaccines at phase 3. It's going to take an awful long time to get those released globally. And that's the problem. This is not going away. It's here. Even if we have a vaccine next year, you know, to immunize, to vaccinate the whole world. And that's the problem. You cannot do that overnight, and that's going to take months and months and months and months. So this thing is still going to spread. Again, I think the focus for Croatia has to be put things on hold, await the recovery, but make sure that you're investing in that stuff that's really going to make a difference. And again, I'd reiterate what Irving said. Technology is really driving the future of medical travel nowadays, and you really have to invest in that.
Thank you very much. In the meantime, we have received a question from the audience. So it's for Mr. Stackpole. Who will suffer more due to limited financial possibilities of patients, holistic or acute? And the question was asked by Mr. Amis Krasovskis.
If I understand the question correctly, the answer is it depends. If you think of the markets for health tourism as medical, health, and then wellness. So wellness being the least invasive, the European Spa Association represents, for the most part, wellness providers and some health providers, but mostly wellness. And then on the other side, the hospitals. If you think of the other side in terms of the medical, the hospitals, the high acuity, high complexity procedures, the market in the middle, that middle part of the market, will recover the slowest. And what will come back first are the low end, in part because that's paid for out of pocket. And those who can't afford to travel and those who are have a very high risk tolerance, or people who are not risk averse, those people will be willing to travel and willing to consume services at some distance, travel to consume those services. On the other end, the high acuity people, these are people whose services may be paid for by a secondary or tertiary funding source, like an intermediary, a government, an insurance company. These people will, of necessity, seek services at distance. And I'm thinking in the Asian markets, in the Southeast Asian markets in particular. In Europe, the market is somewhat homogeneous. And the question about insurance and coverage is even more complex. The insurance companies are, I want to make the point, the insurance companies are doing great in the pandemic, because an insurance company's profit is built on what's called the medical loss ratio. Premiums are here, costs are here, the insurance company makes the difference. Well, these days, the premiums are here and going up, and the costs are going down and down and down. So the insurance companies are doing very well, thank you very much. So who will recover first, or which recovery will be the more profitable? I would bet on the low end of the market. That's where we're finding interest. That's where the clients that we have are seeing the most activity, and I believe that that will continue to be the case for the near term. I hope that answers the question.
Thank you, Mr. Stackpole. It was very informative again, and it's very difficult to foretell the future, but I think this is as good as it gets these days. We have another question, also from the audience, and it's for Mr. Pollard. It's Parkshit Yahurkar that said the question: do you see regulations become more or less favorable towards medical tourism? For example, telehealth, second opinions, telepsychiatry, especially across borders, becoming more or less restricted? Thanks and greetings from Travali.
Yeah, you've highlighted a really good topic, because obviously what we've seen is massive growth in telehealth, telemedicine, and one of the issues there, and that's true in many countries where this has been adopted very, very rapidly in the last 6-9 months, are the legalities of this. And the regulatory side, certainly in the UK, and I would guess in most other countries, hasn't caught up with the legal issues that surround the delivery of healthcare when you are not face to face with a patient. How long it's going to take to sort that, I don't know. I think people are throwing money at it and investing in it, and it is certainly, every hospital and clinic, must be investing massively in this at the moment, but it's pretty unregulated at the moment. But there again, so is most of the medical travel industry.
Thank you very much.
Have you?
Yes, thank you very much. We have another question. So it seems that everybody kind of woke up or actually getting more relaxed in their offices. So for Mr. Stackpole, there's another question. Advertise now or wait till it gets better and people can travel again, so basically you can get better return of your marketing investment?
Okay, what a great question. Advertising in general, advertising is only advised in certain situations, where the service you're offering matches the markets you're attempting to reach in such a way that advertising is effective. The smartest investment right now, in my opinion, is to invest in better understanding what words or calls to action actually motivates your market segment, the segment you're attempting to attract for your services. And this is some of the research that doesn't exist in the sector. And we've tried to find sponsors historically to fund this kind of research, and they're just beginning to come out of the woodwork now. So that's the smart thing to do, is not to necessarily advertise, but to find the words, find the calls to action, the images, the offers that create motivation that will prompt people to act. So if the question is this an okay time to invest in understanding my market? I would say absolutely. If the question is this a good time for us to buy a banner ad or a pay-per-click campaign for people who are inquiring about vacations in Croatia, I would say, no, it's not a good idea. And until you better understand what it is that motivates people to act.
Thank you very much, Mr. Stackpole. That last answer will be very, very useful to many our partners, especially media partners, and to all the audience.